Dr. David Amron again. Why circumferential liposuction? I get asked this question a lot. This is something I developed many years ago, about 20 years ago, that I applied to lipedema patients, which I've been doing for 20 years. I strongly prefer the circumferential approach. There's different ways of going about doing lipedema surgery. I talked about this at FDRS a couple years ago. You can debulk areas and get improvement. You can do a strip approach, either lateral or medial, or anterior or posterior, and get a very good result with things. I feel that doing a circumferential approach is really the best way. Why is that? Number one, lipedema is a circumferential disease. It wraps around 360 degrees areas. So you want to approach that from a disease treatment standpoint in a circumferential fashion. But primarily from a cosmetic standpoint, people forget you're dealing with a layer of fat between the muscle and the skin, right? Subcutaneous layer of fat, and that layer curves. It curves around areas, and you have to follow that layer. And you want to follow it properly and completely without jabbing the muscle, causing bleeding and bruising unnecessarily, or poking and jabbing the skin, causing uneven pullback of the skin. So you want to follow that layer, and you want to follow that layer ideally circumferentially to get not only the best lipedema treatment itself and prevention, but definitely from a cosmetic standpoint. So I strongly prefer the circumferential approach when I do calves and ankles, when I do thighs, when I do arms, and even forearms at one time.